Good morning, dears. Today we are going to discuss about the neuroendocrinal tumors of adrenals. When neuroendocrinal tumors that affects the adrenal and the effect of NET in adrenal that causes too much secretion of adrenocorticotropic hormone. And the NET of adrenocorticotropic hormone causes condition known as Cushing syndrome. The signs and symptoms of Cushing syndrome can be classified mainly as weight gain. On examination of a patient with a net ACTH, a lump or hump over the back of the neck or in between the shoulder blades, and the condition, as you know, a buffalo hump. And on inspecting your patient or on the first look of your patient will have a very round face or a moon face with red cheeks or a pink or purple striae over, especially over the trunk or the body or the abdomen or somewhere else. Regarding the mind or the psychology of patient, as you know, cortisol plays great important role. In acute stress, when the adrenaline plays the lead role, in chronic stress, cortisol plays the main role. So, the patient will be usually very anxious, very irritable, very depressed and fearful of unknown reason. And other feature of our patient is regarding the skin symptom of our patient. The PC of our patient may be just a recurrent acne or a darkening of the skin, especially over the face or the side of the face, then with stretch marks and thinning of the skin may be the PC of your patient. And there is unwanted hair growth, especially on the face or on the trunk or on the back of the arms or anywhere in the body. And that condition is known as hirsutism. And regarding the skin, one more PC of our patient may be easy bruising. The skin may get bruised very easily or on the slightest touch or just scratching the skin that causes easy bruising. And regarding the extremities, outer proportion of the upper part of the body, the abdomen is very pot-bellied or a pendulous abdomen may be the PC of your patient, but at the same time the lower part of the body or the lower extremities are very thin, and you can see the upper part of the body, that especially with the extremities, the thinning of the body. So thin arms and thin legs are the PC of your ACTH tumor with an NET. And regarding the bone complaint, due to the high cortisol, your bones become very thin, and the bones that breaks very easily also. So the slightest sliding may cause breakage of the bones, and sores or cuts that may not heal very properly, or the healing may be very slowly. And on examination, you can see there is increased sweating of the body and excessive hunger and unexplained fatigueness, then flushing. And regarding the female complaint, irregular or absence of menses may be one of the main feature of our patient with a Cushing syndrome. And there is a regarding one PC may be regarding the sexual life of our patient. There is decreased sex drive, or the patient may not have any interest in sex, or there is decreased libido, and erectional dysfunction may be the PC of your patient, or infertility may be the main complaint of patient. Then PC may be severe headache, and on examination you can see your patient may having with a high BP. Sometimes our patient may having some visual problem, or a loss of PC may be the loss of vision may be the PC of our patient. So on evaluating a patient with the Cushing syndrome of a neck tumor, the patient having multi-level problems. Number one is obesity or a deposition of fat, especially over the back of the neck or over in between the shoulders, and pot-belliedness or pendulous abdomen may be the PC, and there are unwanted stretch marks or striae over the skin, and easy bruising may be the skin, and the extremities are very thin, and psychologically your patient is very weak and tired and irritable and fretful and very confused also. And regarding the sex life of sex drive may be very poor, or a patient may not have any interest in sex, and erectional dysfunction or infertility, and in females irregular menses or even absence of menses with constant stress and constant headache, high BP, and thinning of bones and breakage of bones and non-healing ulcers, etc. are the symptom of a patient with ACTH issue. And these are regarding the neck tumors of ACTH, and next can be studied in next class. Thank you for watching. Thank you.